You know, when it comes to the COVID-19 testing, we talked about many times medical racism. And we're seeing that black people more than once have been denied to be tested for the coronavirus. And case in point, you have a sister by the name of Deborah Gatewood. Now, for 31 years, she worked as a phlebotomist at Beaumont Hospital in the Detroit suburb of Farmington Hills. Now, she was working at the hospital. She started feeling the symptoms of the coronavirus. She asked her employer, hey, I need to get a test. They denied her. They say, oh, well, no, you can't get a test. But, you know, you're not feeling well. You can go home. So they said her symptoms wasn't severe. OK, so days circled around and she went back to the emergency room. OK, drove herself to the hospital's emergency room, requested a test, but was sent home again. OK, so they gave her a prescription medicine for cough. Now they say her symptoms changed for the worse. They say she found herself at the hospital again on March 21st. With her fever had spiked during the visit. She had told them that she likely had the coronavirus, but they still denied her a test. Then on March 23rd, she was turned away for the final time. I mean, so you're being constantly turned away from a hospital that you worked at, that you had got the coronavirus because you're being exposed to all these different people coming in. And we have reported more than once, Brother Nathaniel have reported this, that black people in the UK, black people here in America being denied testing for coronavirus. No, so they were saying that the fact that she got infected doing the job she did for 31 years and she couldn't get care from the facility of her own, you know, and they said, meaning Beaumont, they said it's sad. It said that she collapsed inside her Detroit home and she was getting ready to go to another emergency room at Sinai Grace Hospital, but she would spend her final days there. They said that she went up to the hospital, sat in the parking lot. They said, if this is closed, she said, and this is going to happen, I'm going to sit in my car until I get that phone call. OK, so the sister, they said, was heavily sedated. Once they finally put her in there wasn't any interaction. You know, her plan was just to work at the hospital a few more years and then just be, you know, a grandma. You know, she wanted to be with the kids. And, you know, they reached out to the hospital and said, why are you not testing your employees? They said that they admitted that they are prioritizing patients. And I bet you I know what patients you were prioritizing in Detroit. And it sure didn't look like people like me. I know that. Oh, I know that. Trust me, because I know how y'all get down. That's why prevention is one of the best things you can do. But her situation, you can't be a prevention because she was literally on the front lines dealing with all of this. Now, they claim they didn't have enough tests, and the governor, you know, which that's one of the ones they don't like in Michigan. She could complain many times that she didn't have enough tests to Trump, but Trump don't like her. So you already know how that goes. And he don't like you. He's going to be petty and make you suffer. But this is, you know, horrible. And this is, like I said, not only the maybe second, I think, healthcare worker we've covered that passed away of this coronavirus. But for them to say, I'm not going to test you at all, man, look, if I worked at that hospital and I knew where the coronavirus test was at, man, I'm going to get mine. I said, man, I'm going to test myself. Forget that. Forget y'all. I'm getting this test. Y'all not going to deny me, fire me, do whatever you're going to do. It's not against the law. Charge me for it. But if I know where they at, I'm going to get it. And I tell any healthcare worker that they deny you a coronavirus test, it just say, okay, all right, I understand. And go get you one. You know where they at, go get them. Because no, they expose you to that. I'd rather deal with those consequences than sitting there and have coronavirus that y'all expose me to and I can't find out what's going on. Like I said, there needs to be some major lawsuits behind this too. This should never happen again. All these hospitals need to be sued who's doing that to their employees. That's despicable. But leave me a comment, let me know what you think about, you know, this story with this sister. If any of you are healthcare workers, have any of you been denied? And if so, that's horrible. But let us know in the comments.